First question I have for you, now this was very recent that Christine Elliott announced the big changes to healthcare coming, which has been dubbed by the media as a super agency. How do you see that sort of benefiting Ontario's healthcare as a whole?
Well, first of all, I want to tell the people of Parry, Sound-Muskoka, you have an all-star MPP. Norm Miller is a champion. He makes sure that his voice is heard for the people of Parry, Sound-Muskoka and the rest of Ontario. We had a great announcement the other day from Christine Elliott, the Minister of Health, making sure that we end hallway healthcare. We ran on ending hallway healthcare, and these are the steps we're taking to move the province forward. Number one issue that I heard right across the province, traveling and talking to the doctors and nurses and frontline healthcare workers, is get rid of these LHINs. Just get rid of the silos. That's what we're doing. We're getting rid of the silos. We're getting rid of the CEOs and the big paid executives, and we're making sure that we consolidate everything under one administration area, because it's just another layer. And I saw it actually here. Norm saw it when the hospital in Huntsville and Bracebridge, and the LHINs get involved and want to do some wild stuff. Well, that's not going to happen. We're going to make sure that we keep and invest in the hospital here in Huntsville and Bracebridge. That's what the people want, and that's what we're going to do. We have approximately right now 1,200 people in the hallways throughout the province and hospitals, and that's unacceptable. So we're building long-term care beds. So far, we've built 6,000 new long-term care beds. We've committed to 15,000 in the first 5 years and 15,000 the following 5 years. And that will take the people out of the hospitals that should be in long-term care and take the burden off the hospitals. So it'll free up rooms and free up beds.
Some of the critics to this announcement have claimed that this might lead to privatization.
No.
Can you speak to that at all?
Well, 100%. That's just opposition, saying that. We are not privatizing anything. You're always going to be able to use your OHIP card, your health card, and go in and get taken care of.
All right.
And if I may interject on
Please
this,
do.
I'd just like to give a big plug for our Health Minister, Christine Elliott. I think she's worked tirelessly on this project.
Sure.
She has a real unique background in that she was Ontario's first hospital ombudsman, and she also was instrumental on the Select Committee on Mental Health, and she has a real interest in that. And so it's a big change, but it's changed for a good reason, to make healthcare more sustainable and more patient-centered, and so that the system will work better. And I was listening to the briefing from the health minister the other day, and she said it's not going to happen overnight. It's going to take time, and it's a huge job. But I have a lot of confidence in Christine Elliott as the health minister, that she's doing a good job, and she's working tirelessly at it, really, really hard to do the best she can.
Absolutely.
Well, Norm, while I've got you on the subject here, how do you feel like this change is going to benefit Muskoka's healthcare, specifically we've mentioned the 2 hospitals, and there's going to be some renovations going on?
Well, the system being sustainable is absolutely important. I think the Premier learned when he was in the leadership race about the issues of how important having a fully functioning hospital in Huntsville and in Bracebridge is, and you need a system that's sustainable to be able to support those hospitals. And
for sure,
medium-sized hospitals have been challenged in the last 10 years. They've been essentially starved, and the funding formula hasn't been working for them, and that's been demonstrated here in especially the Muskoka side of the riding. These hospitals are really important to the people in this area, and I think the system being sustainable with the changes the health minister making will make it those Vita hospitals here for good.